The opposition says it's disrespectful for the health minister to dismiss the lived experience of individuals as gossip, adding it's also a serious mistake to ignore these over statistics. The GSD highlights the government's claims that nurse numbers have increased over 14 years, saying this overlooks how overstretched the staff is because the infrastructure isn't growing at the same pace. It says the fact is that many vacancies remain unfilled over long periods, claiming this is backed by data, GHA staff and Unite the Union. Shadow Health Minister Joelle Ladislaus says her party has never disputed the decrease in surgical cancellations, but emphasises the government is missing the bigger issue of overstretched staff and patient safety concerns. She calls for the Minister for Health to release the key data, including nurse-to-patient ratios, recent staff survey results and an updated skill mix review. According to Ms Ladislaus, these figures, alongside staff and patient feedback, are essential to understanding the true state of the health service. However, the government has hit back, accusing the opposition MP of engaging in political posturing instead of accepting the Health Minister's offer to review full staffing figures and elective surgery data at the GHA, which it says would allow for a genuine understanding of the situation. It also rejects the GSD's claims that the GHA is understaffed. In a further statement, Minister for Health Gemma Arias-Vasquez reiterates that any vacancies at the GHA are being covered by agency or bank staff and that these posts exist as part of the government's deliberate policy to prioritise the recruitment of Gibraltarians into the service. Ms Arias-Vasquez says it's disappointing that Ms Ladislaus hasn't taken up the government's offer, which she says was made in good faith and in the public interest. However, she confirms the invitation remains open.